Hello guys, imagine you're caught up in a situation whereby you have a casualty with a cardiac arrest. What would you do? Cardiac arrest can be as a result of situations such as electrical injuries, severe bleeding, heart attack, low blood sugar, among other causes. So in the event you have a patient who suspect to be having a cardiac arrest, you need to find out whether there are any signs of life, remove any dangers around you, assess the patient. Hello, can you hear me? Hello, can you hear me? Open your eyes. Hello, open your eyes, can you hear me? If there is no response, open the airway. Find out whether there are any obstructions. Tilt the head back. Check for signs of breathing for up to 10 seconds. If there are no signs of breathing, the urgency is clear. Send someone for an ambulance and a pocket mask. Then start with chest compressions at the center of their chest. Pushing in vertically downwards. At a depth of flow less than 2 inches, at a rate of 100 to 120 compressions per minute. Push hard, push fast. After every 1 to 2 minutes, check whether there are signs of life. If there are no signs of life, continue the compressions, only CPR, until you get a pocket mask. 1, 2, 3, 4, 5, 6, 8, 9, 10, 11, 12, 13, 14, 16, 17, 18, 19, 20, 3, 4, 5, 6, 7, 8, 9, 30, 4, 5, 6, every 2 minutes, 1 to 2 minutes, reassess whether there are any signs of life. If there are no signs of life, continue with compressions only, CPR. So remember, push fast, push hard, at a rate of 100 to 120 per minute, and a depth of not less than 2 inches. So after every 1 to 2 minutes, reassess whether there is sense of life and act accordingly. Now that we have a pocket mask, we'll do a combination of chest compressions and ventilations. Chest compressions will be doing up to 30 chest compressions. Then you alternate that with 2 breaths. So still 30 compressions at the center of the chest, in between the breaths. 1, 2, 3, 4, 5, 6, 7, 8, 10, 11, 12, 13, 15, 16, 17, 18, 19, 20. 23, 24, 25, 26, 27, 28, 29, 30. And get your pocket mask, bulge it outwards, cover the patient's mouth and nose. Maintain a firm seal and an open airway, blow in. Arise of the chest marks an effective breath. Give another one. Then give up to 30 compressions. 1, 2, 3, 4, 5, 6, 8, 9, 10, 13, 14, 15, 16, 17, 18, 19, 20, 23, 24, 25, 26, 27, 28, 29, 30. Reposition the airway again. 1, 2, 1, 2, 3, 4, 5, 6, 7, 8, 12, 13, 14, 15, 16, 17, 18, 19, 20. 24, 25, 26, 27, 28, 29, 30. 1, 2. So we keep on alternating mouth ventilations and chest compressions, reassessing their breathing every 1 to 2 minutes, that is every 3 to 5 rounds. If you are 2, you can alternate every 2 minutes, that's every 5 rounds. So in the event you have a casualty who is not breathing and you have a pocket mask, then you perform CPR by doing 30 compressions and by alternating 30 compressions with 2 rescue breaths, 30 compressions with 2 rescue breaths until the casualty recovers. You transfer care to someone who is more trained, you're out of breath, or you're stopped by a physician. To sum it up, if you have a casualty who is not breathing and you're alone, you don't have a pocket mask with you, perform compressions only CPR, and only interrupt to reassess the breathing every 1 to 2 minutes depending on your capability. If you're doing it, we do the compressions at a rate of 100 to 120 per minute. That means now, after every 120 compressions, you can reassess the breathing, or after every 240, depending upon your capability. In the event you're two trained rescuers, two trained first aiders, you can switch the compressor every 2 minutes. 2 minutes if you're doing at a rate of 100 to 120, that means ideally after every 240 compressions, switch the compressor so as to maintain the quality of compressions. Thank you for watching. I'm Sylvester Odero, Emergency Medical Services Instructor with Medswift Training Consultants. Thank you.